Now the next speaker is Dr. Amrita Shrestha. I think she doesn't need the introduction. She's already star of today. So she is talking about the children's palliative care, Liliko Bagaincha. So palliative care service lead, INF Nepal, Green Pasture Hospital, Sarah Rigbe, speech and language pathologist, INF Nepal, Green Pasture, please. And she is very passionate about advocating dignity in care of, especially for children and adults with a life-limiting condition. Sometimes we forget the children. Even when I was talking palliative care, palliative care is doing a lot of work in pediatric palliative care also, training, modeling, teaching facilities, but I forgot to mention. So I think we need a person like you to hammer all to remind the palliative care. Thank you.
Thank you, Professor Vishnu. So I'm back as a pediatrician this time. I'm really passionate about it, just like Professor Vishnu said, about dignity of care while caring for children and adults with life-limiting illnesses. So I'll be talking about what Liliko Bagaincha really is. But before I go into that, I'd like to give you a little bit of history about how it all started. So INF started working with children with disability in 2007 to provide rehabilitation services, which began with a cerebral palsy camp in the premises of Green Pastures Hospital. And it was run by a multidisciplinary team at that point, but without a doctor. And in the year 2019, I had the privilege to set up the cerebral palsy clinic, especially for children with cerebral palsy. But as the clinic started, we could see a huge number of children with other developmental disorders who would come to the clinic, and which soon led to a development pediatric clinic at Green Pastures Hospital. But even having a developmental pediatric clinic was not quite enough for me personally, because I had more questions than answers, because I would meet with a lot of children and their families with a lot of questions, with a lot of anxiety, with a lot of, they had so much to share, their stories that were not, no one really had time to listen to. And as it was the start of the journey, I had all the time in the world to sit there and listen to their stories. So we can all imagine, when we think about life in all its fullness, to each one of us here, but what about life in all its fullness for children with disability? You can have a think. And we definitely do love happy stories where everything's happy and happily ever after. And whenever there's a child who's a newborn in the family, everybody is happy. It's a start of a good thing. But what if the child has a disability? And that did lead me to palliative care. There are very few pediatric palliative care studies published on children living with and dying from malignant diseases, many facing delays in starting palliative care. But there are no studies on palliative care for children with developmental disorders in Nepal that have been reported so far. And this is the data from Green Pastures Hospital from July 2021 to July 2022 from the Development Pediatric Clinic, that we could see that there was a heavy burden. There was 71% of these children who came to the clinic had palliative care needs. And as I said, that led me to palliative care, from the feeling of we couldn't do anything for this child or for this family to there's always something that we can do. And hence the integration of development pediatrics to palliative care started, and which provided the opportunity for this strategic work to deliver palliative care to children with development disorders. And hence, Liliko Bagaincha was born. So Lily symbolizes love, rebirth, and purity. And to me, to my team, this is what those children that we care for are to us. And Bagaincha in Nepali means a garden. So we soon conceptualized a program that would be Liliko Bagaincha, Garden of Lilies, where these children would be the lilies and the platform or garden where they would be nurtured. So Liliko Bagaincha is a 5-day residential program. It's run by a multidisciplinary team of pediatricians, nurses, counselors, our therapists, patient advocates, and day therapy in charge. If you look at the picture, you see 2 children on their wheelchairs distributing muffins to our nurses in the ward, and they bake those muffins with the help of some of our team members who are right here. And you can see our speech therapist at the bottom. And Sunita actually wrote a song, which you cannot really see clearly, and that has been our theme song ever since, which really speaks from a perspective of a child with disability. What we found, what I found personally, even in the clinics, engaging with these families, was that they had a heavy, heavy burden that they just, walked with every single day. That they needed someone to listen to their stories. They wanted support. They wanted a shoulder to cry on. So when we conceptualized the program, we included several things, and a few of these things were sharing their expectations, their perspectives on the condition of their child or the disease. And we would do a detailed clinical, social, psychological, and spiritual assessments of the families to identify the issues so that we could formulate a plan for interventions. And also we did parental education to manage ongoing care for their child. We would discuss challenges and coping mechanisms that they had already adopted and that they could adopt. We'd also encourage to form a support group where they could support each other if they did not have that support group elsewhere. We would discuss about emotions, which sometimes we'd rather hide and not show, but we'd encourage them that those were very normal. And we'd encourage them to make memories with their children with the time that they had left. And we also provide counseling sessions and sessions on self-care. So if you look at this picture, you would see somebody on a wheelchair being carried up the stairs. These are a few of the challenges that we have to face, and they have to face every single day. This is during one of our trips with these children and their families, and we would take them somewhere which was wheelchair accessible, but at that time, the elevator had broken down, so this was the only option, that they had to be carried up the stairs. And we have a lovely team, lovely parents, lovely, lovely people who are willing to do that in our team and in the community as well. So what we're trying to do is to relieve suffering of these children and their families, to improve quality of life and support these families the best way possible. So from June 2022 to October 2024, we conducted about 7 Liliko Bagaincha at Green Pastures Hospital, where about 32 children were cared for and about 35 family members participated. And we've also demonstrated the similar programs, but a shorter version at 2 different hospitals, in Tansen Hospital and Shining Hospital, Surkhet. And this is the picture from Surkhet Hospital. What we could see is that the families have highly benefited and expressed gratitude for creating such an environment where they felt welcomed, they felt loved, they felt cared for. And they expressed that this was a platform where their needs were met. And globally, it is found that children's palliative care improves the quality of life for children and reduces suffering associated with chronic illnesses. And families in Nepal often bear the overwhelming emotional and economic burden of caregiving without adequate support from the healthcare system, as we know already. And so when we heard all these stories, all these feedbacks, we realized there is a need for scientific evidence on the program's effectiveness in elevating the challenges faced by these families, which would contribute to the improvement and expansion of pediatric palliative services in Nepal, which provides compassionate, holistic care to children with life-limiting illness and their families, with the aim that these programs could be replicated and expanded in other parts of Nepal and similar low and middle income country settings. We developed a proposal for research, which is called the Liliko Bagaincha, assessing the impact of a pediatric palliative care approach on children with developmental disorders and their families at Green Pastures Hospital, with the objective to explore the challenges faced by these families, to identify coping strategies from the perspective of the families, to understand support system of the families, and to assess the impact of the program itself in addressing the challenges of these families. So this is the conceptual framework. I will not go into detail, but what we do is we have about 5 to 6 families in every group where we have them for 5 or 7 days, depending, and then we run these programs. So the methodology of the study is qualitative exploratory research design. And we have successfully conducted 2 programs this January and February after the NHRC approval. So a total of 26 in-depth interviews were conducted using in-depth interview guidelines with primary caregivers, primarily mothers, by independent researchers. So some of the findings from early analysis have been that one of the moms said, "I don't go anywhere leaving him. I don't go anywhere. My mother goes and comes back, but I don't go anywhere. If I need to go, I take him with me, but don't leave him, because as he eats only if I feed him. If I go anywhere, he cries a lot. It becomes very difficult for him. He cries a lot." This was pre-program. And post-program, the same mom said, "I had a good experience here. Now I have idea about how to massage my child, that is, to connect to my child better, how to make him sleep, how to feed him. Along with that, I also learned about the importance of self-care." And another mom said, post-program, she said, "We didn't interact with her often. I knew even if she doesn't talk, I need to talk with her." The other mom said, "We also shared our experiences as well during the program. We shared our happiness and our sadness. There was an open discussion among parents where we shared our experiences. We talked about how our children ended up in this condition, starting from conception, their time in the womb, and their birth. I also shared my child's journey and how everything happened." So they found a safe space where they could share things openly and very freely, without hesitation. And that was because we built a relationship with them in the beginning. So early insights from this study provides evidence that structured interventions like the Liliko Bagaincha program can help relieve the burden through the support provided by the palliative care team. And this also made the families aware about the importance of self-care while caring for their own child. So integration of children's palliative care for developmental disorders improves quality of life for these children and their families, and it brings hope for these children and their families who face isolation and social stigma from their society. I'd like to say one thing that Dame Cicely Saunders said: "You matter because you are you, and you matter to the last moment of your life. We will do all we can to help you, not only to die peacefully, but to live until you die. Stay curious and be present is all I'm going to say. And then we're going to watch a video from our Liliko Bagaincha, and then Sarah is going to come up on stage."
ठ्याक्कै अब संयोग भनौँ या भाग्य भनौँ मैले चाहिँ लिलीको बगैँचा भन्ने कार्यक्रम पनि भेटाएँ जुन कार्यक्रम चाहिँ मेरो बाबुको लागि चाहिँ एकदमै राम्रो रहेछ र मेरो बाबुको साथसाथै हामी बुवा आमाको लागि पनि धेरै राम्रो रहेछ। अब यो कार्यक्रमले गर्दाखेरि चाहिँ हामीले बच्चाको केयर मात्रै होइन कि बुवा आमाले आफ्नो केयर पनि गर्नुपर्छ, बुवा आमा बच्चा सँगसँगै आफ्नो स्वास्थ्यको पनि ख्याल गर्नुपर्दो रहेछ र बच्चा र बुवा आमा दुवैले अब मनोरञ्जन पनि गर्नुपर्दो रहेछ टाइममा। अब टाइम मिलाएर यताउता नयाँ नौलो ठाउँमा चाहिँ बच्चालाई पनि घुमाउन लानुपर्दो रहेछ भन्ने कुरा चाहिँ थाहा पाएँ।
हामीले चाहिँ कहाँबाट चाहिँ यस्तो कार्यक्रमहरू पाउँछ होला भनेर चाहिँ हामी पनि एकदम चाहिँ भौँतारी चाहिँ थिएँ। यो आउने क्रममा चाहिँ ठ्याक्कै अब यहाँ लिलीको बगैँचा भन्ने कार्यक्रमले चाहिँ हामीलाई धेरै राहत र सपोर्ट दियो। त्यसमा हामी एकदम धेरै खुसी छ। भन्दै हामी जस्तो यस्तो अपाङ्ग बच्चाहरू अरू पनि धेरै होला हामी जस्तो पीडित, अब अरूलाई पनि जाँदा जाँदै अरूलाई पनि यस्तो कार्यक्रमहरू पाइयोस्, अरूले पनि सहभागी हुन पाइयोस् भन्न चाहन्छु।
मलाई यहाँ आउनुभन्दा अघि न्यास्रो जस्तो लाग्थ्यो, मेरो बच्चा हिँड्दैन जस्तो लाग्थ्यो। यहाँ आएपछि मलाई खुसी लाग्यो, मेरो नानीहरू जस्तो अरू नानीहरू पनि भेटेँ। मलाई एकदम महसुस अब म पनि केही गर्न सक्छु नानीको लागि भन्ने सिपहरू सिकेँ यहाँबाट।
Video. So part of what I get to do at Green Pastures Hospital is I'm the rehabilitation coordinator, and I'm also a speech pathologist. And through our team of rehab professionals and working with Sunita Project and Palliative Care, we've been able to be so involved in the programming and in influencing these children's lives. So palliative care and rehabilitation go hand in hand because we're both sides of the spectrum are focused on quality of life for patients. And how we do that is through a multidisciplinary care team at Green Pastures Hospital. We've heard a few hints about it from different people already today, but multidisciplinary care, or sometimes they say interdisciplinary care, or all different terms, but mainly it's when professionals from ranges of disciplines work together to deliver care that addresses as many of the patient's needs as possible. So at Green Pastures Hospital and through Sunita Project, our multidisciplinary team consists of doctors, nurses, nutritionists, counselors, physiotherapy, occupational therapy, speech therapy, prosthetics and orthotic services, pharmacy, lab, the spectrum continues. And we have a really unique relationship in Green Pastures Hospital and with Sunita Project in that our therapists who have been hired by the Sunita Project also were parts of our therapy departments and our rehabilitation services departments. And we were able to cross-cover each other. We were able to learn together. And when we had challenges of staffing in one of the places, we were able to help each other cover those areas. And so it's been a really great testament that we've been able to work together to help this program be known more. Because as you may have heard, there's not a lot of rehabilitation professionals in Nepal. And so we need all that we can get to help accomplish things. So as we think about how can multidisciplinary care be utilized, even at a center like Green Pastures Hospital that does have all of the pieces of the puzzle, we still have waiting lists of patients who need direct care. And so we've really had to consider how can we impact patients and have a broader impact on the country of Nepal. And there's usually two models that we can think of. The first is through a direct care model, which is the traditional model that we all think about, where we meet the patients individually, we do daily sessions with them, it's kind of hands-on. This is really specialized care where our team is seeing the patients individually and we're doing everything. All the care is facilitated through a trained professional. And that's a great model. And if you have the resources and if we have really tricky cases, we need that model. You know, we saw a lot of that model in the story about Sunitha we saw earlier. She came to Green Pasture so that she could get the specialized hands-on care she needed from the physiotherapist, occupational therapist, and speech therapist at the hospital so she could go home to a better life. But often we don't have the resources to give that care. And so what we can do is more of a consultative model. If we look at Nepal's statistics, there are only 1,345 rehabilitation professionals in Nepal across 7 disciplines, and that's from a 2022 study. And so if we think about only 1,345 professionals across 7 disciplines, that's not enough to do a direct patient care model. So what we've been doing through the Liliko Bagaincha program and through other services in Sunitha Project is to do more of a consultative model. So the care providers, the professionals, do the evaluation and the personalized treatment plan. And then we really engage the caregivers to be the providers for their patient. So anything we do, any treatments we provide, we have the caregiver right there with us. They're helping to facilitate it. And then that we really found the caregivers are empowered, the caregivers are excited that they can do something with their patient. One of the quotes that Dr. Amrita said is, "Now I know that talking to my child helps even if she can't talk back." That's a huge impact on a change of caregiver mindset. And so we really are trying to empower the caregivers that they can do the care model. And the benefits that we've been seeing to all different patients have been huge. And as I've been listening over the past few days of the conference, you know, so many different people's stories have had therapy and rehabilitation woven into it. Dr. Rajesh's video that he shared earlier today of a patient with a spinal cord injury and transfer training for that caregiver and protection for that caregiver's back would be so important. Smriti ma'am shared a story about a patient who needed parallel bars built at home and training so that he could do physiotherapy. And then Sunitha's story, as I've already mentioned, that she was able to come in and get rehabilitation and therapy care to improve her quality of life, even with a chronic condition. One last story I want to share for today is a story of Sarans, and his mom gave me permission to share his story. He first came to a Liliko Bagaincha program when he was 4, about 2 years ago. And through our multidisciplinary team, our physiotherapist Tina is here now, and she was reminding me that he had no head control and he had no sitting balance when he first came to us 2 years ago. And we worked quite hard with Sarans's mom to help teach her techniques. You know, our prosthetics and orthotics teams made him AFOs and made him a corner chair so that he could sit up and engage with his community. He wasn't chewing and eating well, so our speech therapist worked very hard on that. And our occupational therapist worked to help him do some grasping and some hand mobility. He just was back in our January, just last month, 2 weeks ago, yeah. He was just back at our hospital 2 years later. And it took me a moment to recognize it was the same child. And the mom said, "Don't you know me?" And I said, "Maybe." And she said, "This is Sarans." And so I had to go back and find this little picture of him in his yellow outfit because now he's sitting up, he's grabbing things. I was holding a car toy thinking we were going to talk about it, and he grabbed it out of my hand and put it in his pocket. And I thought, this can't be the same child. And his mom's confidence has grown so much. She says, "I know how to care for my son. And I know with his disability, we can still do okay." And then something else that really impacted me was she'd bought in. She knew the benefits of training and working with her son. And as we were training the whole group, another mom came to me and said, "Well, why aren't you giving my son speech therapy? He needs to be able to talk." And I'm kind of thinking like, oh gosh, I thought we just had talked about we're empowering you to do it. She didn't understand a word I was saying. And so Rans's mom came over and she said, "It's not her job to do it, it's our job to do it. That's what parents have to do. She's taught us what to do." And it was such an impactful moment for me because I thought, this woman's got it. And she was able to then train other parents about the impact of being able to care for her child. So thank you so much for, just your support of pediatric palliative care and the rehabilitation needs that are also facilitated through that. Thank you.
Thank you, Dr. Shara. And I think Dr. Amrita and Dr. Shara, this session is complete.